Dr. Sasser, thanks for being here this morning, and maybe tell us a little bit about your practice. And I think my notes say that you're new to the hospital.
Yes, sir. So my wife and I moved here. We bought a house in March and just started working in May. So I'm originally from Wilmington, North Carolina. I went to undergraduate at Appalachian State, did my medical school at UNC Chapel Hill, residency back in Wilmington, where I met my wife. She's also a family doctor. She's working in the Jonesville office. I'm in Dobson. And then right after residency, we moved to her hometown in Pennsylvania, which is very rural, probably more rural than we are here, but a town of about 4,000. And we worked there for about 3 years, and we moved back to my hometown in Wilmington. We opened up our own practice that we had for a couple of years, and then decided to transition to here mainly because Wilmington is just growing so rapidly. It's not really the environment that we wanted for our family. I personally, and my wife as well, we practice very full spectrum family medicine. So we like to try and handle, 70 to 90% of the complaints that come in, and not just send people to specialists. I do women's care, do men's health, sports medicine, concussion management, acne treatment, probably acne treatment and sports medicine. If I had to pick something is what I like to do more of, but honestly, I just like having a variety. I like to see a 2-year-old and then a 90-year-old and, do a procedure and then talk about their mental health. And, I just like a varied day. I think my wife is very similar, but she has more of a passion for women's health and children, and does more of that in her practice. She's actually going to be over the newborn nursery at the hospital, taking that over for Dr. Groner.
What's been the impact to your practice, or what you've seen day to day here now with this world pandemic that we're dealing with?
So it's a little bit of a different situation for me since we just started working here at the beginning of May. When you're a new provider, it takes usually about 2 years to fill your panel, and so things would have been slow for me regardless right now. Right. They're certainly slow across the system at the moment. But things are starting to really pick up. And then we're also especially the express care side and the other things that Hugh Chatham has done. They've done a lot of COVID testing. They're treating a lot of patients and managing that very well. Having come from Wilmington, I was also working for Fayetteville's hospital system for Cape Fear Valley, and then being familiar with New Hanover Regional Medical Center, I can tell you that they've handled it really well here. They're doing more testing, and it's more readily available than it was there in a lot of respects. So it's pretty impressive how they've responded here versus some larger entities.
Well, it certainly has, I think, shown a light on the medical profession and also the first responders and people, that work in the units every day, around the clock, 365 days a year.
When I was seeing patients more in the hospital, I stayed away from my son for 2 to 3 weeks just as a precaution. And I know a lot of docs nationally that they're sleeping in their garages or things like that, or have sent their kids to other states to live with in-laws so they don't have to put their family at risk. So.
Well, what do you think your biggest challenge is in medicine now and in being involved in a practice?
Things are always changing. I think the biggest thing right now there is a trust issue. I think between the World Health Organization, the CDC, and other local environments, they've not handled things well, and it's put a little bit of lack of trust into the public eye. The CDC's come out and just admitted, hey, we were counting things wrong when we were counting the number of tests. We were including the antibody test in with the PCR test, and that wasn't appropriate. The things with the way the WHO handled it.
Joe asks, are you seeing an increase of patients using the healthcare sharing ministry coverages that are out there as opposed to conventional health insurance? Health insurance is obviously something people are dealing with now.
So I haven't seen it here yet. Of course, I haven't seen that many people. In Wilmington, absolutely. Of course, our practice in Wilmington was a cash-based practice, a membership model, direct primary care. So I would say 25 to 50% of our patients had some type of program like that. We personally used Liberty Health Share for a while. They work really well when you know the system, and if you know places where you can get cash-based using Healthcare Blue Book. There's cash-based surgery centers, the Oklahoma Surgery Center. You can go online and they have a price for exactly how much your knee replacement is. And you can call up, your local ortho and ask them how much theirs is going to be. And of course, they won't know. It takes 2 to 3 weeks for them to figure that out. But
Right.
It's pretty impressive.
Another question is, are you working in a satellite office in Dobson, or are you out of the hospital directly, or do you have a bricks and mortar location where you are? That comes from John Tarn.
So I'm in the Dobson office. The express care that's already here, on the other side of that, they've built out a family medicine side, so it's in the same building. I work with that and can see express care patients if need be and supervise our NPs and PAs there. I also have hospital privileges, newborn nursery privileges, and if something were to happen with the pandemic, they can call me up to go and take care of that, or if a bunch of people get sick, I can go in and sub in.
Great. Connie Hamlin asks, are visitors allowed to go inside the hospital to visit and connect with social workers and case management at this point, or are there restrictions, I guess?
Currently, the last I heard, which I believe was earlier this week, was no visitors at this point. Unless you're a patient, they don't let you in. I think the exception I've seen to that is if you're doing some outpatient labs and things where you kind of sit in the lobby. I've seen kids and stuff come in with their parents to get labs drawn. But as far as an admitted hospital patient, no visitors at this time.
Another question from John. He said, talk about the mishandling. Are the numbers of cases, in your view, overstated or understated? There have been a lot of numbers being thrown around.
Yeah.
And you mentioned them briefly, yeah.
To quote Donald Trump, tremendously. They're really understated, and it's just the nature of how they're reporting. So let's say that you feel sick and you go to the doctor and you get tested positive for COVID. And they say, well, you're doing okay and you're okay to be at home. And you go home and your wife gets it and maybe your kids get it. Unless they go and get tested, they're not being reported. So just off of how they do that type of reporting, you can easily take the number of cases and multiply it by 2 to 4, and that gives you a more realistic number of cases. And then you've got the mess ups where they were now, if they were adding in the antibody testing to the PCR testing, the question is how many of those patients overlapped. So that it's hard to say. And if they didn't overlap and they were just tested on the backside, that it's a real number. If they overlap a lot, then it's significantly lower. But those are CDC numbers versus other places that are reporting. When you Google it, you'll see different numbers reported from CDC and local health departments. They're usually pretty similar, but there's some lag there in where their reporting is.
John also had another part of the question here is whether you're using telemedicine at the facilities, or have you seen an increase, or how has that affected your practice? Is it being used more?
Our practice in Wilmington, we already used a lot of telemedicine, so it pretty much stayed the same. We just did an increase in home visits and increase in parking lot visits. Here at Hugh Chatham, they've set up a lot of providers with telemedicine capabilities, and they actually have an on-call provider at the urgent cares and express cares that if someone needs a telemedicine visit, they can call in and request that, and they're kind of on call to do those visits. A lot of people don't know about that, and it's probably not being taken advantage of. I've also worked for telemedicine companies like Teladoc, and know kind of how that works. Nationally, before the pandemic, the lawyers were going after telemedicine a lot, and so a lot of places were staying away from it.
Right.
So I'm interested to see, post-pandemic, does it become the norm or does it still become an area of litigation? Just, my wife and I are new here. We were enjoying it very much. We're both wide open for new patients. So if you know someone that needs a doctor, we're here. We both also do a little bit more of integrative or natural medicine. So a lot of times, if you're not someone who wants to be just put on the medicine, we have lots of other options for you. And also just, being with the chamber, our practice in Wilmington, we were members of the Wilmington Chamber of Commerce and really
Right.
enjoyed these type of mixers. We got a lot of referrals, and gave a lot of referrals from them. So
Awesome.
glad you guys are doing that.
Well, welcome to the community, to you and your wife. And if there's anything that the chamber can do to help you, please don't hesitate to call us. And we certainly appreciate what you do every day. And it is, as I said, I think a very honorable profession. And healthcare in our community is one of those things that we need to make sure that we have a community that is healthy and vibrant, and especially nowadays during this pandemic. So good luck, Dr. Sasser, to you, and I'm sure we'll be seeing you in the community again, and get in touch with us if we can be of help.
Will do. Thank you for having me.